First responders all know the three letters PPE. Healthcare workers on the front lines are battling this contagious virus, and they desperately need PPE, personal protective equipment. It means gowns, gloves, goggles, face shields, hand sanitizer, masks. Medical professionals across the country are taking to social media themselves to warn the rest of us, their potential customers after all, about these shortages. Bloomberg reporting hospital workers in Washington state have resorted to making face masks with office supplies because they don't have enough. Right now, the CDC's website is suggesting healthcare workers could, quote, use homemade masks like a bandana or scarf for care of patients as a last resort. However, homemade masks are not considered PPE since their capacity to protect the workers is unknown. Here to talk about it with us tonight, Amy Lee Patchak, a nurse at Stony Brook University Hospital in New York, and on the telephone, James Lewis, a respiratory therapist also with Stony Brook University Hospital. Amy, to you first. Tell us what it's like for you on the front lines so our audience can, if they possibly are able, help in the fight.
So what we're seeing right now is a rise in patients coming in with COVID-19, varying symptoms. Some are just coughing and being able to be put on the floors. Some are being intubated and being critical care areas. I work in a critical care area. My institution is like a lot of institutions in the sense that we, the practitioners, have a lot of fear and insecurity about this situation because our institutions and the government have not provided us with the appropriate equipment to properly protect ourselves to care for these patients. So what will happen eventually, and what is starting to happen now, is that the healthcare professionals are getting sick, and we haven't even seen the height of this pandemic.
James, are you getting tested? And isn't a test a snapshot in time? So you may test negative for that day. You may be exposed the next?
No, sir. We haven't been tested. And as far as I know, there isn't any conversation of us being tested. We're just monitoring symptoms and taking temperatures daily.
When you reach for equipment, when you reach in a drawer for a mask, when you reach in a drawer for a face shield, is it there?
Face shields and masks, no, are typically held by the administrators because, unfortunately, they're a hot commodity right now. People are stealing them. You know, visitors steal them, or anyone will steal them. We even had somebody run into an ER and grab a box of masks and run out. So unfortunately, they have to be doled out on a case-by-case basis, which can be frustrating, but I guess it's only going to get worse from here on out.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.